Hi ladies, the core connection breath is one of the foundational skills I will teach you when you are training with me, especially foundational to pregnancy and postnatal rehabilitation exercise. So with your breathing, you treat your core system like a canister. So when pressure is placed on the top of that canister from your inhale as your diaphragm goes down, you put more pressure on the rest of your core, okay? So when you exhale, the pressure is relieved. It's kind of like a balloon or a ball. So if you put pressure on the top, it pushes pressure around the rest of the ball, okay? So we want to ensure you are connecting with your core. That's why it's called a core connection breath. You want to inhale, relax everything. So your diaphragm goes down, and on the exhale, we let everything recoil back up, including our pelvic floor and our core muscles. Okay, so obviously in pregnancy, your core and your pelvic floor have a little bit of pressure put on them from your pregnancy, from the weight of your pregnancy. So the pelvic floor is slightly weakened, as is your core muscles, especially this area down the center of your tummy, like called the linea alba. So your muscle bellies can separate apart to allow for your growing baby. So if we don't control this pressure in our belly, you will end up with a weakened and widened pressure, and also potentially weakened or stretched and not so good functioning pelvic floor. Okay, so that's why it's important to do this breathing with your exercise. Make sure you're not putting too much pressure on those places. Okay, so to do it, we want to lie down. If you're pregnant, you probably want to be on your side. It might be a bit uncomfortable on your back. If not on your back, we want to do our inhale. So we want to breathe 360 all the way around into our back and down into our pelvis. So hands on the lower chest, lower ribs. Breathe into your fingers at the front and your thumb at the back. And exhale. Do a couple of those. Inhale, breathing right down into your core, not up into your chest and shoulders, okay? Get that breath going down. Okay, then we're going to add in our pelvic floor activation. So inhale down, relax your pelvic floor, and exhale. You want to connect with your pelvic floor, so do your pelvic floor exercises. Hopefully you know what this is. But if not, you want to activate, draw out, imagine you are stopping a fart, stop holding in a tampon and stopping a wee, and then relax on your inhale. On your exhale, you do that pelvic floor activation. Inhale, and now one more step, we're going to add in a deep core activation. These are our transverse abdominals, so place your finger between your belly button and your hip bones onto your belly, and imagine you are pulling your hip bones together. So see if you can feel that deep activation if you do that under your fingers. So you want to do that on your exhale as well, so with your pelvic floor activation. So inhale, relax everything, breathing all the way down into the back as well, and on your exhale, connect with your pelvic floor and your deep core muscle. You might want to think about zipping up a pair of jeans, so use it from the back all the way through your pelvic floor up to your belly button, so that activates your pelvic floor and those deep core muscles. Now, closer look with the belly. So think about connecting with your core. It's not a suck in of your belly, it is a gentle activation. That's it there. So inhale, relax, exhale, connect with the core. See, there's barely any movement of that belly. It's deep and underneath those fingers. You just want to feel a subtle activation. Okay, I will leave it there so as not to keep this too long. Practice is the key. Inhale on the easy part of an exercise. exhale and connect with your core and pelvic floor for support of your foundation on the hard parts. Okay, good. Enjoy.